I'm Mark Brodsky, and I'm a physician who cares for performing artists. I'm here with Griffin today. Griffin, nice to meet you.
Nice to meet you.
Can you tell me about the pain in your forearms?
Well, it started probably 2 years ago, and it started in my right hand from working on picking technique, and so I started working on my left hand a lot and kind of relaxed, not working on the right hand as much, and then it flared up in the left arm as well. And I've seen massage therapists and acupuncturists and physical therapists and like a wide array. I think something like 6 or 7 different people, different doctors.
How has your injury affected your playing or your sound?
Well, obviously, I had to take some time off. So obviously, losing a lot of practice time was not helpful at all. And so mostly my technique, but actually kind of learning to relax and try not to not tense up as much has helped my sound a lot.
Great. Was there a specific piece you were practicing a few years ago, or any kind of change in practice habits that you think may have triggered your right forearm pain a couple years ago?
Well, it was my senior year in high school, and I was really busy with APs and college applications and things like that, and so I wasn't practicing as much. So I think that the time I did spend practicing, I was trying to make up for lost time, and that just caused a lot of tension, and I think that's when the injury started.
Many times an injury can start when there's an acceleration or a change in practice patterns, and then that kind of emotional stress of your AP exams and preparing for college. We often see that it's a accumulation of factors that result in pain. And then we have pain, and then it's a matter of rehabilitating. We always kind of want to know what's the cause. Was it like an infection or was it a trauma? But many times, it's like a hit and run accident, that the initial problem's gone, and now it's just a matter of recognizing where we are and treating those symptoms. What kind of treatments were most effective for you? So you've had a whole bunch of different modalities that have been used on your pain.
I would say stretching. That's really the only thing that ever really helped. I mean, icing helped, but I don't know if that just made me not feel the pain, but like it didn't fix anything. But stretching is the only thing that really seemed to do something.
Can you show some of the stretching exercises that were most helpful?
Well, this is a good one. Like moving your kind of like a prayer pose, moving your arms back and forth, like that. Let's see. Just normal shoulder stretches. The kind go back to gym class, arm circles and stuff. Let's see. This is good. Crossing them and then lifting up like that and switching. Let me think. Oh, okay. This is called. I got this one from a DVD. It's called Hot Palms. Stick around like that, and then you rotate, and then you go to the side and do the same thing.
Great.
Yeah.
While you're up, can you play your guitar a little bit? And what we look for in the physical exam is usually working with a guitar teacher or whatever musical instrument the person plays to look at ways to minimize tension on the body and stress on the muscles.
Okay. Just play a tune or something?
Perfect, yes.
Okay.
I've often been asked the question, are musicians and like athletes? And I say absolutely. I mean, I was trying to count the number of different movements you did on your left hand and your right hand, and you know, the muscle was actively firing and very busy. Have your teachers given you any advice on different positions of your neck, your shoulders, your hands? Have you gotten any kind of feedback in terms of minimizing the stress on your body and technique and posture?
Well, in terms of guitar pedagogy, I mean, and this goes as far back as guitar does. The left hand is pretty easy. You just want a neutral wrist, you know. That's all there is to it, basically. But pick style guitar, you know, I mean, classical guitar is obviously much older and there's much more like codified pedagogy. Pick style guitar is relatively young, and so there's a lot of disagreement on how you should hold your hand, whether or not you should rest it on the strings, or if you should anchor your pinky on the pick guard, or what you should do. So, I mean, I've investigated all of those. I've had teachers tell me I should float my wrist. So that I think really that's where the problem comes from, not having like the right technique.
You mean there's so many options that you have a lot of choice depending on the size of the guitar and the size of the guitarist. It can all change an individual.
Even holding the pick, some people think you should hold it like between the flat of the thumb and the side of the finger there. Some people think you should hold it between the flat of the thumb and the side of the thing, like that part of the finger. And then like George Benson holds it kind of like this, like he bends his thumb back and it's on the flat of the thumb and the flat of the index finger. And you know, there's just tons of variations.
Okay, thank you very much. Why don't you put your guitar down and we'll talk a little bit more. Other than the tension in your forearms, do you have any tension in your neck or shoulder area? Do you notice that?
Yeah, I do. Yeah.
Can you tell me about that?
That's a heavy guitar, so I think the strap has a lot to do with it. Also, having to hold my arms at different heights, you know, for extended periods of time, I think create a little imbalance.
When you practice, do you use a strap or do you sit down?
Yeah, even if I'm sitting down, I use a strap.
Have you figured out any strategies to try to minimize? I mean, obviously when you're playing, there must be certain situations where you need the full weight of the guitar holding it up on your neck and shoulder. Have you devised any kind of strategies when you're practicing to try to minimize that?
Well, if I cross my leg like this, then this leg is higher, and so it lifts the guitar. So more weight is on the leg. Then that's pretty much all I can do.
Okay.
Or maybe put it on a footstool.
Yeah, I've actually seen some guitarists who will put a cushion between their guitar, and that way their sit bones can be straight and they can maintain a good posture without having to kind of contort their body to get the guitar higher. Yeah. Tell me about your neck. Where do you feel the tension in your neck?
Like, I guess right there. No.
Okay. Anything kind of on the back between the shoulder blades?
Now that you mention it, maybe, but I don't usually notice it.
Many times it's the neck can transmit pain and tension into the forearm, so that's a great place to start. We say a pain in the neck is more than a pain in the neck.
Yeah.
So is it okay if I examine you a little bit? Can you stand up?
Okay.
And just stay right there. So I'm going to kind of push down. And is anything tender in there?
Yeah.
Okay. And kind of in this area here as well?
Less so, but still a little bit tender.
Okay. And kind of drop your chin down. I'm going to push right on your neck right here.
It's not too bad, but it's a little tender.
Right there. How's the range of motion? I saw you lift your arms all the way over your head. Okay. How about the range of motion of your neck? Can you stand straight and turn your head to the right and the left as far as it goes? So range of motion's good. Do you have any tension when you turn like that? Okay.
Not really.
So 2 acupressure or 3 acupressure points that would be really good are in the forearm right here.
Mm-hmm.
Can you feel that right there?
Yeah.
So if you hold your side, either hand, and then there's a crease right there, you push into the bone right in front of the arm. You feel that?
Yeah.
So once you do that yourself, kind of, and everything should be relaxed.
Okay.
And don't forget to breathe. And you should just put enough tension on the thumb for the tip of the fingernail to turn white.
Okay.
Perfect. And to kind of take a breath. And then do the other side. And take a breath. And then interlock your fingers. Kind of push them into this. You feel right there, that muscle knot right there.
Yeah.
Okay. And you can let your chin drop and let your elbows drop so they're relaxed. Take a few breaths. And I can tell you're in the right spot because your face looks very relaxed. Okay, excellent. And then for those hard-to-reach spots behind the back, you can put 2 tennis balls in a stocking, lean against the balls, kind of release the tension by leaning against the balls. Also, when there's tension between the shoulder blades, many times the pectoralis muscle, this muscle can be tight. You feel it right there?
Yeah.
So if you let your arms fall to the side and stretch those muscles out, that can kind of open the chest and decrease the length of the muscle in the back and optimize the function so it's not always under tension. So have a seat.
Okay.
Do you notice that stress, you had mentioned that the strap and the weight of the guitar can increase tension in the neck, the forearms. What about stress for performance or, of life?
Yeah.
Do you notice any correlation that can make things worse or better?
Yeah, I mean, like I said, it started my senior year in high school, and if I had to pick the most stressful year of my life, that would have been it, So definitely a correlation.
It's really interesting because many times the body will hold in tension. So these muscle knots are very refractory, or they're resistant to being released because there's a reason for them. And some of the procedures we do at our office are acupuncture and something called trigger point injection, where we kind of put a needle into that trigger point and release that. In addition to the lifestyle things that we mentioned, like sleep and exercise and diet, anger management, stress management, social support, your acupressure with breathing. And many times, once these points are gone, there can be, and the self-care continues, there's prolonged relief. So thank you very much. Did you have any questions?
No, I think I'm
Okay.
good.
Okay, great. Thanks.
All right, thanks.